interactive thing. So I'm posing a question for you. In a patient with, that's my symbol for with, you'll see that quite often when you do nurses' notes and stuff. That's patient. In a patient with cerebral edema, which IV fluids would make this situation worse? The choices: a hypotonic solution, a hypertonic solution, an isotonic solution. So you're taking everything I just showed you and applying it to a question like this. I know what you're all thinking. WTF. Right? Okay, I'm going to show you. You can do this. But you got to do step by step. You got to apply this stuff. Okay. Just to show of hands, and don't be embarrassed, just show your hand a little bit like this, so that I get an idea. All right, we'll do like a pre-test, and then we'll ask it at the end. Who here thinks, makes it worse, a hypotonic solution? Okay. Who thinks a hypertonic solution? Okay. Who thinks isotonic solution? Okay. One picked isotonic, but it's kind of mixed over here. Let's talk about this. Okay. Not too bad. So, what we have is this. Okay? You basically have a cell in the beaker of water. Okay? So, this cell in this beaker of water, each one of those blue, let's just say that's sodium, okay? So is it more concentrated inside the cell or outside the cell? Inside. So the outside would be considered hypotonic, hypertonic, or isotonic? Hypotonic, okay? Water follows solute. If I put a cell in a hypotonic solution, which way does the water want to go? Water follows solute. Into. Good. Okay? So it goes in. When that happens, what happens to the cell? Does it lyse or does it crenate? Lyse. It bursts. Okay? You good with that? Okay. Let's do, so we're on the same page. So you have this situation now. Few inside, many outside. The cell is in what type of solution? Hypertonic or a hypotonic? Hyper. When that happens, which way does this water want to go? Into the cell or out of the cell? Out of the cell. And if that happens, does the cell want to crenate or lyse? Crenate. Shrink. Good. Any questions so far before we go into this? Believe it or not, you know this, you could answer this quite easily. Okay. We have a blood vessel here, and we got cells over here. side too, but I'm just doing myself. Now, let's say in these cells, what's the concentration of sodium chloride inside these cells? 0.9%. Are we in agreement with that, right? Okay. Now, if I put, and let's say these cells here are your brain, the cells of your brain, because we're talking about cerebral edema. Well, let's say right now it's just normal, okay? There's no edema there. Inside the cells is this way. Now, if I put .9% sodium chloride in the bloodstream, an IV that you're going to drip in the person's bloodstream, does the water want to move from the bloodstream into the cells or from the cells into the bloodstream? Neither. Good. That would be easy. Okay? What if I change that percentage to, let's say, 3.0%? Now, is this more concentrated than inside the cells or more dilute? Concentrated. So this is hypertonic or hypotonic? Hyper. So you're given what kind of a fluid? A hypertonic solution or a hypotonic solution? Hyper. Right? Hyper. Okay? Now, when that happens, there's more ions here or is there more ions inside? Is it more in the blood or more in the cells? Blood. So when that happens, water follows solute. Which way does the water want to go? Into the bloodstream or out of the bloodstream? Into. Good, good. So it goes this way. What does that do to blood volume? What does that do to blood pressure? Good, increases. What does that do to the cells themselves? Dehydrated or edematous? Dehydrated, do the opposite. See that? What if I give, I'll twist it a little bit. What if I give distilled water? Ooh. What kind of ions are in distilled water? None. Distilled means that there's nothing in there but water. So what's the concentration of distilled water? Yeah, 0.0. Does that make sense? Okay? So now the question is, what's more concentrated? I'll take this distilled water off for a moment, time being. Let's say we're going to give an IV fluid of 0.45% sodium chloride, which would work in the same way as distilled water we receive. Is this more concentrated than the cells? No. Is this hypotonic or hypertonic? Hypo. Is there more water here or more water up here? Or more water in the bloodstream or more water in the cells? In the bloodstream. It's more dilute. Again, go into that lemonade. You got crystals and water. What's happening here is you've got some crystals, we've got a ton of water, making it very dilute. Then I got another picture, I got some crystals in there with a few drops of water. Making it very concentrated. So I ask again, where is there more water? Inside the bloodstream or inside the cells? Bloodstream. Always worse when I talk about food. Okay? So if there's more water over here, but it's concentrated with sodium over here, which way does the water want to go? Water follows solid. Goes out into the cells. when you give distilled water, which you would hope, I would hope you don't do ever, but if you ever gave distilled water to the person's bloodstream, or something that's hypotonic, what does that do to blood volume? Think about it. Very cool. You put a hypotonic solution in someone's blood, what's going to happen to... Now, immediately you're going to be putting blood, you're going to put water in there. I understand. Water goes in there, but what is your body going to do to adapt to it? The water is going to leave here and go into your cells. So adding just distilled water is going to do what to blood volume? Decrease in the long run. When I say the long run, we're talking about minutes to hours. What happens to your cells? They swell. Well, they won't. They can burst, and they do if there's a lot of fluid coming in the hypertonic solution. But you'll get first these things swelling, and that's where you get edema. Does that make sense? Because there's an oncotic pressure that's going to be drawing the water that way. So, these are your brain cells that are already edematous. If there's tons of water there, that it's not going to be 0.9%, it's probably going to be, I mean, it's hard to measure that, of course, but it could be, let's say, 0.4%, 4.5%, 4.5, and this would be, your normal would be 9 over here, you see? Oh, wait, is that yeah, okay, that's right. So that's what's happening over there. But there's so much, and there's a lot of reasons for cerebral edema. It could be infections, could be a motor vehicle accident, a lot of reasons. We won't go into there right now. So that's what's happening here. So your body, this whole snowball effect happens, gets worse and worse. So the question is, what's the worst thing you want to put in here? All right, so here's the question. Would you want to give a hypotonic solution, a hypertonic, which one will make the situation worse? A hypotonic solution, putting 0.45, or let's say 0.2%. A hypertonic solution, maybe 5%. An isotonic solution, 0.9% is what you would put in. What would make it worse? What would make those cells in there more edematous? You're saying hypo. What are you saying? Okay. What if I gave hypertonic, we give 3%. Where's the water going to go? Is it going to go in the bloodstream? In the bloodstream, and that's a hypertonic solution. You see? So is that a bad thing? No, it'll actually probably correct it. Depending on what the cause of it. I don't want you to think that it's that easy, because there'll be a lot of reasons going on. Because then you could also have high blood pressure. Right? Well, what if I gave 0.9%, something that should be isotonic? Where's the fluid want to go? Into the bloodstream or out of the bloodstream?
Water.
Yeah, but where does water want to go? Into the bloodstream? When this is 0.45 and this is 0.9, where's it more concentrated? Here or there? In the bloodstream or in the cells? Where's more concentration? In the bloodstream. So where does the water want to go? Into the bloodstream. So putting in 0.9% will also make it somewhat better. See? What if we give a hypotonic solution? Let's say 0.2%. Is this more concentrated or the bloodstream more concentrated? The cells are more concentrated. So where does the fluid want to go? Out of the bloodstream or into the bloodstream?
Out of the blood.
Out of the blood, so it'll do this. If that happens, are we getting more edematous, or is there dehydration going on in the cells? Edematous. So given a hypotonic solution, is going to make the cerebral edema worse.
If the cell concentration is what you're doing is at 1.5, the blood is at 0.9, when is the cell already losing blood?
But it's an ongoing thing. It's a snowball. It doesn't just stop there. So whatever's causing the cerebral edema is getting worse. You see what I mean? I'm trying to isolate it. It's hard to isolate because otherwise your body tries to adjust to it, but there could be other things going on. You don't want this. Right now, these cells are already swelled up because they're dilute. They're edematous. They're big, these cells. So you, if anything, you want to draw fluid from there into the bloodstream. Does that make sense? You see it? So, in a patient with cerebral edema, in a patient with cerebral edema, which IV fluids would make this situation worse? Isotonic? No. Hypertonic? Hypotonic. See that? That's a question from your NCLEX. You got to know your fluid. It becomes fun. But like, you know, now we're getting to the point where you do need to memorize a few things. What is hypertonic, hypotonic? Well, you got to apply this stuff. Once you get them and you get the answers right, it becomes more fun. You want to do more of it. It becomes like Sudoku. Okay? Now, also, test-taking strategies. Don't do what a lot of students do, and I did this too in early my college years. Don't read into the question. Don't put words there that are not there. Because in actuality, it's not so cut and dry like this in real life. What if the person has bad kidneys? And if you're actually going to draw water into the bloodstream, you're going to increase the workload on the kidneys to release the water. Or what if they already have high blood pressure and you're trying to draw fluid from the brain and putting it into the bloodstream? Now their blood pressure goes up higher. What I'm saying is, yes, there are complicated situations, and that's the real world. But this says, this question has nothing, says nothing about kidney failure, says nothing about the person who already has high blood pressure. So don't, that's what it means by reading into the questions. Just, it's an isolated thing, just answer the question, don't say what if, because it's going to turn into, then you're going to second guess your thoughts here. So I'm trying to also teach you as I go along this test-taking strategy. Okay? Questions on that?